702.
Health and wellness.
23 minutes before 12 o'clock. Time now for our health and wellness feature. And today we are talking about walking and running as a form of weight loss. Have you tried running, and has it helped you with losing weight or walking? You know, there are people who talk about 10,000 steps a day. I mean, is it really the gold standard for weight loss, or is there more to it? I'd like you to share your experiences with us, because I want to talk to Derek Archer, who is the head of strength and conditioning at David Marist, Inanda, and director at FitPro. And I want to ask him really, what's the best way to do it? Because when it comes to losing a few kilos and improving your health, many people wonder, actually, what works better? Is it walking, or is it running? And yes, both forms of movement can burn calories and boost fitness levels, but they do differ in intensity, in impact, and in sustainability. I mean, you know, not everybody has access to gyms, especially in this country, or high-end equipment. So walking and running becomes, you know, the best option for some people. It's the simplest, it's the most affordable way to keep fit. So what's the best way to do the walking and to do the running if weight loss really is your target? Have you tried it? 011-883-0702. WhatsApp's on 072-702-1702. Derek, thank you so much for joining us. Welcome back to the show.
Good. Thank you very much for having me. Great to be here again.
Yeah. So walking and running, how do they compare when it comes to burning calories and supporting weight loss?
Okay, so ultimately your body's burning more energy while you are running. So your energy consumption or caloric expenditure is going to be greater when you're running. But at the end of the day, that number of calories that you're burning is dependent on the intensity that you're training at and the duration you're training at. So if we look at walking, for instance, your intensity is a little bit lower, although you could walk with intent and really push to walk hills and those kind of things to make the intensity a little bit higher without breaking into a run. But running does tend to burn more, and obviously the higher intensity involved with running, and if we push our running even further, the intensity actually creates a little more stress on the body, obviously, and that has to be dealt with after. So during the recovery process, your body also burns more calories to help you recover. But in saying that, duration is a big thing. So if we are going to work at a slightly lower intensity, in other words, we're going to walk instead of running. If we walk with purpose and we have a good metered duration of time that we're spending exerting ourselves or participating in walking, then we will start to burn a lot of calories. And it needs to be obviously a consistent thing. Consistency is key.
Okay. So there are some people who have different body types, who will say, okay, for me, running worked better. Some will say, oh, walking for me worked better. Are there certain body types? And of course, some people say, nah, it didn't work for me. I've been running for so long and I'm not losing weight. Are there certain body types or fitness levels that benefit more from walking than running, or vice versa? So how do I know what could work for me is running or what could work for me is actually walking?
Look, at the end of the day, this is down really much to the individual. So firstly, it's about a choice. Okay. So they decide whether they're going to walk or run. Sometimes we may be impeded by things. So if we're carrying a lot of weight, for instance, it may not be great for our knees and our joints to start running. Whereas walking, because it's more of a daily activity, it's much more easier for us to follow something like that. So if we, for instance, the weight may be an issue, we may have injuries, may have issues with our knees, for instance, or back problems, where going straight into running may be more detrimental than actually any good. And also someone that's perhaps a sedentary person. So now let's say they're wanting to get into exercise to lose weight. They're starting with just to generalize and say they're starting with a low base, then we just need them to start moving. It's better to get them to start walking rather than going into a run. Rather, once they're comfortable walking, and if you look at walking, if we just take walking as our theme, obviously, there are different ways of walking. And one, we can just be taking a casual stroll versus going out there and actually walking with intent, moving your arms, walking, taking nice steps, nice strides, and using your whole body to walk. Walks can be as beneficial. And for someone that's just getting into it, they're a great way to start, but also not as, walking is not as intimidating psychologically as running is as well. So walking is a good way for a lot of people to get involved in it. That walking, once they get more comfortable, their joints have been accustomed to load, their muscles have got stronger, and they feel more comfortable in themselves, then perhaps running would become the next option.
I see. And then what about the 10,000 steps? I mean, that's now like a famous thing. Where does that number come from? And is it really a good guideline?
Look, it's been around. I think it started with in Japan in about the 1960s. It was part of a big marketing campaign, and they said you should be doing 10,000 steps a day, and that's kind of stuck. And it's a big number if you think about it. For some people, a bit too intimidating. For others, okay, those are on their feet all day. 10,000 steps is quite achievable. So, look, it's been a good marker so far. There was some current research. In fact, one of the articles was released last week, funny enough, that said 7,000 is actually the marker. Where they've noted changes in health, and this is primarily from a health perspective. Because remember, when you're training, certain elements or certain should we say combinations of intensity and time bring about a change in our health-related fitness components versus those that are, if we're pushing hard and training for an event or training to be fitter, you're required to do a little bit more than just those that are beneficial for health alone. So if you're looking from a health perspective, getting someone to a position where they're doing 7,000 to 10,000 steps a day, but they're getting the benefits from a health perspective. So lowering our cholesterol levels, improving bone density, changing blood sugar levels, those kind of things, decreasing the risk of heart disease, all the non-communicable diseases, also the risk of those decrease as we get more active. So 7,000 steps, according to that article, was the marker where we start to decrease the risk of our non-communicable diseases, so your heart disease, dyslipidemia or high cholesterol, high blood pressure, depression, anxiety, those sort of things, the mental or emotional component of it as well. So I'd say 7,000 to 10,000. I mean, most people are quite happy with 10,000 because, like we said, it's a big number. But 7,000 seems to be a current indicator. But I would stick with 10,000. Although for many people, perhaps the 10,000 seems like a bridge too far. 7,000 might be an intermediary step to get there. So maybe work on the 7,000 and then go on to the 10,000. As you get more comfortable, you want to give your body more.
Okay. Let's go to some WhatsApps now. 072 702 1702. What do you prefer, running or walking? If, of course, weight loss is your target. How many steps do you do a day, or how many kilometers do you run every week or per day? And has that helped you lose weight? Let's start with your WhatsApps.
Hi, Clement. This is Karabo in Midrand. With me, walking did a lot of wonders for me. And initially, I was just walking just for the fun of it because I hate running. So I had a herniated disc that prevented me from doing a lot of stuff at the gym. So I opted to wake up and walk every morning. And within 3 months, I had lost 4 dress sizes. So for me, walking, Jonga, best. It really worked wonders for me. Thanks, Clement. Bye.
That's amazing. Well done. Mpo is asking here, which activity tones muscles better?
Versus between running and walking?
Between the two, yeah.
Okay, so remember, when we're walking or running, we're training to do something for longer. So we're training for endurance. And yes, it is going to bring down our body fat levels, and it will work those muscles significantly, but not as much as combining it with a bit of strength training as well. And that might just be body weight stuff. You don't need to be in a gym. You can be doing squats and lunges, even push-ups. If you struggle with push-ups, you can put your hands on a table so that you're doing a slightly angled push-up to make it a bit less. But you need to stress our muscles slightly differently. So remember that the shape and the strength of the shape of our muscles and the sort of structure benefits quite significantly from strength training in addition to your walking and your running. And it doesn't have to be huge amounts of training. Just 2 strength sessions a week in addition to your walking or your running will make a big difference. And you'll feel it even with those exercises like your squats and lunges. Your walking and your running become even more efficient because now those muscles are even stronger, and they'll make your running and walking a lot easier too.
Okay. And then Anonymous says, Clement, I'm obese. I prefer walking, but I don't see the difference. Any advice from Derek?
Okay, so that's the thing, that it's down to an individual. So when we are looking at someone who is struggling to lose weight, there are a number of elements. Firstly, diet is a massive element. That's the first thing. Secondly, activity levels, but also, if possible, your body's you're physiologically controlled by hormones. So all our sort of internal processes. So if we are, if there's an issue and you're not losing weight, even after looking after your diet, after being as active as possible, it might be a good thing to go and get your blood checked and to check what your hormone levels are like. Because sometimes if the hormones are out of sync, it can be something simple like, after pregnancy, the hormones don't return to normal, as we've seen sometimes postpartum ladies battle to lose weight. But also, things with age, it could be stress. Our bodies are subjected to quite a few different variables that can affect our hormones. So that would be the next level to go and check, just to make sure that your insulin levels are correct, your blood sugar is right, those kind of things. And that's a good check for your overall health. But that might be the answer. Sometimes we can be training till we're literally blue in the face and not lose the weight that we should be expected to because our bodies are not responding in the right way based on the hormones. So that would be a good option to check as well.
Okay. All right. So 12 minutes now before 12 o'clock. When we come back, we will hear from more of our listeners, get some of your voice notes and also your calls as well.
702 Health and Wellness.
10 minutes before 12 o'clock. Straight to your WhatsApps.
Hi. So my husband has cervical myelopathy in his 4th and 5th, I think it's C4, C5, and C6. What type of exercises should he do? Thanks. It's Beryl Rankin. Bye.
Okay, so some spinal challenges there. Okay, cool. I'll get Derek to respond to that.
I'm curious in terms of walking, the relationship with, injuries and having had a sedentary lifestyle. I'm in my 50s. Last year, January, I started walking regularly, 3 to 5 kilometers, 3 times a week. Everything went wonderful, got fitness, lost a little bit of weight, really enjoyed it. And around about July, I started having, niggles, hip pain, things that wouldn't go away. And I couldn't figure out what it was. Different theories from people saying, it's tendinitis, bursitis, all those fun things. Couldn't shake it, took breaks, tried everything, reduced distance, went slower, etc., etc. Eventually, March this year, my GP referred me to a hip specialist, only to be told that I need both hips replaced in my early 50s. I didn't have any pain or issues before. Did I just draw a short straw here? Or is there a relationship to maybe be, exercising too much too soon? So, I'm just curious to know. Thanks.
Sure, interesting. Yeah, Derek?
Okay, so on the first question around the spinal injury or the spinal complication, that those, you definitely, those are, that sort of individual would possibly need to just check with a biokineticist or a physio as to what their limitations are. And if there's been a fusion and the neck is secure, then obviously, you're trying to avoid impact. Walking stuff possibly would be good, and even cycling as an option, like stationary bike cycling, that sort of thing. But once again, that would be down to a medical professional who actually assesses that gentleman, or what assesses his neck, just to make, you can't sort of say something on the radio not having actually seen the gentleman in person. And the second question about the hips, I don't think over that duration of time you would have done that much damage to your hips. It depends on your footwear. Perhaps your foot mechanics might be slightly out, so the impact going through your knee joints and hip joint might have been excessive. However, in saying that, you could have had an issue building over time. It could have been related to bone density as well. There are a number of variables. I don't think you can put it straight down to only walking. I know you did suddenly start and you carried on quite for a period of time, quite a long period of time. But I don't think that would have done it yet. Once again, we have to check whether any underlying conditions, was any genetic thing. Did any of your parents have anything? Any of your siblings have issues with their hips? Those are kind of the variables that I need to take into account. But at the same time, it shouldn't have created that much of an issue unless there were lower mechanical issues or bone structural issues.
Here's another voice note.
Also a challenge. Yeah.
Got you.
Good day, Clement. You know what? I have started running. I do between I think I only have 2 weeks running, but then I normally do between 5 and 6 kilometers. Then within like maybe 55 minutes. But I'm worried, man. On weekends I don't normally run, but yesterday I did my very same routine. But then after I developed a knee pain. What could be the reason for that? Thanks, Mbuyisenia.
Derek?
Wow, that's also going to be one of those ones where there's so many things that can possibly have happened. It could have been stepping wrong. It could have been overloading. But if he's only just started running and he's running too much, so if he said he's just been running for the last 2 weeks or so, then if I heard correctly, then it might be too much too soon. It might be his footwear, his shoes. If the shoes are not, they don't provide enough cushioning. If his feet are landing differently or not evenly on the ground, should we say, not through the normal gait cycle. There are a lot of different things there. But what he should do, based on the pain level, if he's lost function, in other words, he can't really walk around and stuff like that, he should seek medical advice. If it's just sore and like achy, rest a little bit, maybe use the ice treatment to, for 20 minutes at a time roughly, to try and bring some inflammation down. And as a last resort, if he's taken them before, if he's used to it before, some sort of anti-inflammatory medication. But, if it's really serious or hurting, the good idea is to get some sort of medical personnel to have a look at that.
Okay, got it. And then there was somebody else who asked about, hey Clement, please can you ask Derek there about like a 50-year-old who is going up and down the stairs? Like, does that help as well? So as opposed to running, like just doing the stairs?
Definitely. In fact, one of the prompts we had was, if you aren't able to go and walk outside, what can you do? And stairs are great. Obviously, as long as you do it safely and rather, walk purposely up, work hard to get up, and then coming down, obviously be a little bit more cognizant of not losing your balance or putting your foot wrong. But walking up and down stairs is really good for you. Remember, your body doesn't really know what you're doing. Your brain knows you're going up and down, but the body just knows that it's got to provide energy to get those muscles to keep functioning, to allow you to keep moving up and down those stairs. So stairs are great. In fact, you can add some variation in it. If you become very proficient or very comfortable doing it, you can step up every second step, for instance. So it forces your legs to work a little bit harder. So it's a little bit of a variation, just from a strength perspective, but also will make your exertion level go up as well.
Yeah. Derek Acha, thank you so much for your time. He's the head of strength and conditioning at St. David's, Marist, Inanda, and director at FitPro.